everyone, welcome to ES Pharma Education YouTube channel. Today in this video I am going to explain about third pharmacokinetic parameter, that is metabolism. Metabolism, it is otherwise called as biotransformation. It is otherwise called as biotransformation, metabolism or biotransformation. So, what is the definition of metabolism? I am going to explain. Metabolism is change in the chemical nature of the drug in our body. Metabolism means chemical alteration of the drug in our body. So, whatever the drug we are taking into our body, that drug chemical nature is changed. The changing of the chemical nature of the drug in our body is known as biotransformation or else metabolism. So, I have already told you that the drug, in order to get absorbed in our body, one criteria is followed. That is, the drug, in order to get absorbed in our body, it should be lipophilic in nature and in unionized state. This is the criteria which is to be followed in order to get absorbed in our body. Whatever the drug we are taking, that drug, in order to get absorbed, it should be lipophilic nature and in unionized form. This is the criteria. So, the drug, after showing its mechanism of action, it should be excreted out. So, in order to get excrete out, this criteria doesn't work. The drug, in order to get excrete out from our body, after showing the mechanism of action, it should be always water soluble form and in ionized state. So, the drug, in order to get excreted out from our body, these criteria should be followed. That means the drug should be water soluble in nature and in ionized state in order to get excreted out from our body. So, in order to follow this criteria, the drug nature should be changed. So, the drug should be metabolized before it is getting eliminated from our body. Mainly, the metabolism takes place in the liver. So, this is the explanation. In general, you remember metabolism means chemical alteration of the drug in our body. What is the chemical alteration? Means alteration of the drug from non-polar. Non-polar means lipid soluble state. From lipid soluble state to polar. Polar means lipid insoluble state. Conversion of non-polar state to polar state. That means lipid soluble state to lipid insoluble state is known as metabolism. So, till now we have completed what is the definition of metabolism. Next, coming to where this metabolism takes place, site of metabolism. Mainly, metabolism takes place in liver. Mainly, the metabolism takes place in liver. Apart from liver, some of the drugs gets metabolized in other organs also. For example, some of the drugs gets metabolized in kidney, skin, plasma, lungs, GIT. In some other organs also, some drugs gets metabolized. So, in most of the competitive exams, you can come across this question. They will give you one of the example of the drug. Where this drug gets metabolized, they will give you the question. So, you remember this table. This table is very important. In most of the competitive exam, you can come across this question. So, vitamin D drug. Vitamin D drug get metabolized in kidney. Then penicillin and insulin. These drugs get metabolized in GIT. Then next coming to 5-HT, that means 5-hydroxytryptamine drug. 5-hydroxytryptamine drug get metabolized in lungs. Then next coming to succinylcholine. Succinylcholine drug gets metabolized in plasma. Then next coming to 7-dehydrocholesterol is converted to cholecalciferol. This conversion takes place in this conversion takes place in skin. 7-hydrocholesterol is converted to cholecalciferol. This conversion takes place in skin. These are few examples of the drugs where the metabolism takes place in some other organs apart from the liver. The best example, the first example is in kidney, vitamin D drugs gets metabolized, and in GIT, penicillin and insulin gets metabolized. Next, coming to 5-hydroxytryptamine. 5-hydroxytryptamine gets metabolized in lungs. And then next, coming to succinylcholine. Succinylcholine drugs get metabolized in plasma, and in skin 7-dehydrocholesterol is converted to cholecalciferol. So these are few examples of the drugs where the metabolism takes place in some other organs apart from the liver. This table is very important. In most of the competitive exams you can come across this question. So till now I had completed what is the definition of metabolism and where this metabolism takes place. Then next, coming into third topic, that is in how many steps the metabolism takes place. Metabolism mainly takes place in 3 steps. The first step is active drug. Active drug is converted to inactive drug. And second step is active drug. Active drug is converted to inactive metabolite. Then third step is inactive drug. Inactive drug is otherwise called as prodrug. So this prodrug or inactive drug is converted to active metabolite. These are the 3 steps of the metabolism. So the first step is active drug is converted to inactive drug. So the best example for this active drug is converted to inactive drug is ibuprofen, paracetamol, chloramphenicol, propranolol and lidocaine. These are few examples of the drugs where active drug is converted to inactive drug. The best examples are paracetamol, ibuprofen, chloramphenicol, lidocaine and propranolol. Then next, coming to inactive drug. Prodrug is converted to active metabolite. So the best examples of the prodrugs I will share you one of the mnemonic to remember this prodrugs. In most of the competitive exam, you can come across this prodrugs. They'll give you one question. What is the example of prodrugs? So you have to remember this prodrugs. So in order to remember this prodrugs, I'll share you one mnemonic. The mnemonic is all prefer doing MD in clinical subjects. So all means A means ACE inhibitors. From that ACE inhibitors, except captopril and lisinopril, all other ACE inhibitors are prodrugs. Then next, coming to prefer. Prefer means pre means prednisone, proton pump inhibitors and proguanil. These are the examples. Then next, coming to doing. D means dipivefrin. Doing. Then next, coming to M means mercaptopurine, methyl-dopa and minoxidil. These are few examples. Then next, coming to D means levodopa. In levodopa, D means levodopa. Next, coming to in means irinotecan. Next, coming to clinical means C means cyclophosphamide, clopidogrel, then carbimazole. These are few examples of the clinical mnemonic. Clinical means cyclophosphamide, clopidogrel, carbimazole. Clinical subjects means sulfasalazine. These are the few examples of the prodrugs. In order to remember the examples of prodrug, you remember the mnemonic. All prefer doing MD in clinical subjects. Okay. In this video, I had explained about what is the definition of metabolism and where the metabolism takes place and in how many steps the metabolism takes place, and few examples of the drugs which are metabolized from active form to inactive form and inactive form to active metabolite. If you like this video, please like, share and subscribe ES Pharma Education YouTube channel for more videos regarding pharmacy. And don't forget to press the bell icon.